All right, the clock has struck 4:15. Thank you for coming on our Job Spotlight series on healthcare administration. My name is Erin Cohan. I'm one of the directors of talent acquisition for Northwestern Medicine. I'm here today interviewing Chris Butler, who is an administrative fellow at Northwestern Medicine. Before we jump into the series, advance the slide, just wanted to go over some housekeeping. During this presentation, please stay on mute. We encourage you to ask questions in the Q&A tab on the right side of your screen and stay with us. All the Job Spotlight interviews will be recorded so you can start viewing the others starting tomorrow. So a little bit about health administration. So in Illinois, the median wage is just about $105,000. Currently, we have just under 15,000 health administrators in Illinois. Annual openings in Illinois is just over 1,000 each year, and the 10-year growth rate is 6%. Most healthcare administration roles require a master's degrees. The health service administrators plan and direct healthcare services, oversee all parts of a clinic or hospital, set budgets, and oversee how money is spent. Some healthcare service administrators oversee departments and specific areas of a healthcare facility. They hire staff, establish work schedules, and assign duties to staff. Health administrators often take on special projects related to quality of care, efficiency of operations, growth, technology, community affairs, and more. Whoop, sorry, I advanced it too soon. So now I am going to start the interview with Chris Butler. So Chris, tell us, how did you become interested in a career in healthcare administration?
Good afternoon, Aaron. Good afternoon, everyone on the call. Just want to reintroduce myself. I'm Chris Butler, first year admin fellow at Northwestern Medicine. To answer your question of how did I get into healthcare admin, it honestly was not a direct path. So, like many of my peers in this profession, I first had aspirations of working in healthcare on the clinical side. So I wanted to be an orthopedic surgeon with a specialty in sports medicine. I have a heavy background in athletics, so that was part of the reason. But my reason for being a surgeon, wanting to be a surgeon, I tore my ACL my freshman year of high school, and ever since then, I wanted to help others who would experience the same thing or prevent those from experiencing what I went through. And so my reason for being in healthcare has always been about what I can do for the next person. Obviously, being a orthopedic surgeon didn't pan out. Now I'm in administration, and the reason for that transition is because as an administrator, you're in a position to have a much greater impact on the patients, on your workforce, et cetera. And so the more impact I could have, the more enjoyable my career would be. And I think that's proven true early on.
Excellent. And you're experiencing being here in the healthcare field and your, experience in it. What do you feel like health administrators do?
There's so many different things that health administrators do. If you look at the slide, obviously it says we work on projects related to quality of care, efficiency of operations, et cetera, et cetera. There really is no limit as to what an administrator does. The projects we work on vary. I've been on projects that are as simple as improving morale of PSRs, which are simply the people that check you in when you walk into a healthcare clinic. I've worked on projects looking at budgets and how do we become more cost effective in our operations. So there's a litany of things that health administrators can do. I like to say I learn something new every day, which is true. And I think any administrator would echo that sentiment.
Now that we're on the topic of projects, so I know we'll dive into what administrative fellows are. And your current, role as the administrative fellow, what is your favorite project you've been working on so far and why?
I'd say it's a tie between, I'm working on 7 projects in total. I'd say my 2 favorite, the first is a patient throughput project in oncology. And the second is a community affairs project I'm working on with our network hospital out in Palos Heights. And so to talk about the first, the oncology throughput project, I'm learning a lot. I have very little experience in healthcare, definitely don't have the clinical knowledge that many of my peers on that project do. And so just the fact that I'm learning a lot, I attach myself to that project on purpose to step out my comfort zone and learn new things. And I've gotten everything I desired out of that project and then some. So just the challenge is really what excites me the most about that project. There's a lot of interaction with clinical leadership, lead physicians. There's some interaction with administrative leadership as well, directors of operations, folks in quality and analytics. So I just really enjoy the team and I love the work we're doing. But above all else, I just love how much I'm learning with that project. And then the community affairs piece I mentioned at our network hospital in Payless, it's really people based. So it's not too much problem solving and a lot more boots on the ground, interacting with others and building relationships. We're working on establishing a pipeline program between our Payless Community Hospital and local community colleges in that area. And so getting an opportunity, which I'll actually do in a couple of weeks, go and visit some of these community colleges, meet with their professors, program directors, and figure out a way to establish a future partnership. So I love both of those projects for different reasons, but those are probably my two favorites.
Awesome. And back to the administrative fellowship. So kind of a twofold question. So how did you find out about the administrative fellowship program? What made you apply to the administrative fellowship program?
Yeah, so the admin fellowship program, I stumbled upon it in a funny way, actually. The summer of, actually, let me backpedal. The early winter of 2021, I was looking for jobs at NM. Again, I told you my background is strictly in athletics, and I tried to beat that drum as much as I could before deciding, okay, I can't have a career coaching or in athletics. I need to look for a job in what I go to school for. And so I was throwing darts at the wall. And in an attempt to apply for an internship, I actually accidentally applied for the fellowship at Northwestern and was quickly denied. But I did, through that process, I met folks such as Aaron Cohen, and they relayed to me the summer internship, the graduate administrative internship. So I applied for that. I was fortunate enough to get the position. And through summer 21, I was an intern at Northwestern. And that's when I learned more about the fellowship, just in, preliminary conversations with senior leaders about, who I am, why do I want to do the internship, and, what were next steps for me once I finished my master's program. And I quickly learned that the fellowship was the absolute best next step. And so I pursued it, and, this whole journey for me, why I applied largely in part because people told me it was the next best thing to do. This whole journey in healthcare has been completely exploratory for me. Again, it's a step out of my comfort zone. I like to joke with people and say, two things I never thought I'd be doing in my career is wearing a suit to work and working in an office, and I do both. And I couldn't love it more. So, again, just really taking that chance, exploring, and it's paid off. It's paid off for sure. So that's how I found out about the fellowship through my internship. And I applied because, it just felt like the right thing to do. I heard it was the right thing to do, and, God willing, I'm here. So it's a great journey so far.
Excellent. So maybe tell everybody about the structure, like the first year, and then what you're going to be doing the second year in your fellowship.
I'm sorry, could you repeat the first part of the question? You cut out.
Oh, sure. Tell what you're doing in your first year of your administrative fellowship, and then what you are going to be doing in your second year of the fellowship.
Absolutely. So in the first year, again, I mentioned how we're working on a litany of projects. That's really what the first year of the fellowship is geared towards. So in the first 60 to 90 days or so, you get acclimated to the system. Northwestern Medicine is a very, very large health system, 11 hospitals, over 30,000 employees, and over 120 folks in senior leadership positions. So you really spend the first 2.5 months or so of your fellowship getting acclimated with those senior leaders, which has been a great experience. Networking has been phenomenal. And once you move out of those meet and greets, you start to identify projects, which I've done now. Again, I'm working on 7. And so I'll be working on these projects really throughout the duration of that first year. Some may stop short of a year, maybe about 8 to 10 months. Others may go a little bit over a year, but that's the bulk of what I'll be doing in the first year of the fellowship. The second year, I transitioned into an interim manager role. That management role is largely dependent on what area I'm interested in and where I do my projects, but I'll also have some assistance from my mentors, other leaders throughout the system who may encourage me to be a manager in one area or a certain area. If I had to say, where do I want to be a manager right now, I'm really not sure, And that's largely because my projects have pulled me in all different directions. I'm meeting so many different folks around the system, and I'm working in a lot of different areas. So there's a lot to like about the job. So really over the next couple months, as I continue to work on projects, I'll also start to think about what area I may want to be an interim manager in.
Awesome. I know, kind of thinking forward. So once the fellowship ends, where do you what jobs do you think you want to pursue, or where do you see yourself post fellowship?
Yeah, definitely still in healthcare, definitely still at Northwestern Medicine, a great organization. I love the work I do. I love the people I work with. In terms of what specific role, I can't speak to right now. Again, and that's mainly because I'm working in a lot of different areas. For example, in that community affairs piece with the Payless Project and building that pipeline program, that's something that I could see myself continuing to do for the next 5 to 10 years, just working in that community affairs bucket. But I'm also really enjoying, traditional hospital operational projects, working in oncology. So perhaps being, a practice manager or director of operations is certainly in my line of sight, 3 to 5 years down the line from now. So again, for me, it's really just a matter of figuring out, what's most comfortable and, where I fit the most. As long as I'm making a difference, which is what I got into healthcare to do, then I'll be happy wherever I end up. But two things for certain, or one thing for certain, definitely at Northwestern Medicine.
That's what we like to hear. And so with your experience with the graduate internship and then being in this fellowship, what skills or attributes do you find make a successful healthcare administrator or healthcare leader?
Yeah, I'd say there are two skills in particular, but before I, talk about those, I just want to make a note that, again, this system is so large and there's room for all different types of folks. Everybody, a lot of people you'll meet have vastly different skill sets. A lot of folks that work here at Northwestern, didn't always work in healthcare. You've got people with business backgrounds, people with, law degrees and, lawyer backgrounds. You have folks that are consultants. We even have a media team. So people who are interested in that type of work, marketing, et cetera. So there's just a wide variety of skill sets and everybody's knowledgeable and intelligent. And so with that being said, I think two skills that all those different folks have in common are first and foremost, just great communication. So, a lot of the projects here are done in teams. Everything here is done in teams. You can't move the needle or get a project done or make any type of improvement without the help of others around you. And so being able to effectively connect with those folks is vital to your success as a healthcare administrator. And then also task management and being organized. Everybody around the system is incredibly busy with their own bucket of work. And so just being able to prioritize healthcare, the flow of the work in this industry, it oscillates a lot. You may have a couple weeks where you're super busy and the wheels are always turning. And then you may hit a couple weeks where things just seem to not be moving at all and it's very slow. So being able to effectively, task manage, stay organized, and prioritize your list of projects or your work is going to be equally huge to your success and also just to your overall work satisfaction. If you're not balanced, if you're not well organized, you can start to feel burnt out or fall behind on certain things, and you don't want that to happen. So again, just being an effective communicator and team player, and then also just being organized. I think those are the two things that'll go a long way for a healthcare administrator.
Excellent. And so multitasking is extremely important. So maybe Chris, explain to us, because you are working on 7 projects, which is a lot to juggle. What are some things that you have implemented to help yourself keep organized and keep on time?
Definitely spreadsheets and Excel. I was one of those people that would always just keep notes on their phone, and that was good enough. But you need a little bit more in this profession and at this level. So using spreadsheets just to stay organized and just keep a running list where it's visible and easily accessible, so I can always see what I need to do and when things are due. Because with those 7 projects, they all have a different pace. I have some projects that span from now until 2025, and I have some projects where folks are looking for results, before the end of 2022. And so that spreadsheet really helps. And then also, leaning on the folks who've been here a lot longer than I. One of the beauties of the fellowship is that you get so many mentors, formal and informal, and they've all been instrumental in just helping me stay afloat. Whether it be, hey, I need to drop one of my projects. How do I go about it? Or, hey, this project, people are asking for a lot, but I'm having a hard time moving the needle. How can I get this in a position where we can continue to move forward? And then also just meeting with folks to say, hey, I'm burnt out, et cetera. So it's really, the mentors have really been instrumental in just helping me stay afloat and on top of things, as well as those spreadsheets.
Yes, spreadsheets, Outlook, all those different things help us all stay on track in a really busy industry. Another thing that I like that you mentioned about making successful is that like teamwork and collaboration. So thinking back to like your education and different roles that you had, what are some things or advice you'd give to college students that are interested in pursuing a healthcare administrative, a healthcare admin fellow role? What are some things that you would encourage them to try to do to build those teamwork and communication skills, which are vital?
Yeah. For me, I had a bit of an unfair advantage. I was a former athlete, so playing basketball at UConn, you learn to be a team player pretty much from day one. But for those who aren't athletes, joining organizations, looking for leadership positions, part of my journey to or really my entire journey to the fellowship is about as unorthodox as you can imagine. If you look at my resume, outside of the internship at Northwestern, I didn't have any hospital experience. Instead, I was a basketball coach. I was a Pilates instructor, a writing tutor, a program director for 2 student groups at my university. I taught a class for seniors my second year in grad school. I was an academic mentor for student athletes. And so you don't necessarily have to seek out those leadership positions, although they do give you great insight and great perspective on what it means to lead, especially if you aspire to be a leader, an administrative leader in healthcare. But then just also, joining those clubs and organizations and, being a part of those groups for a long time. So if you're only doing 1 or 2 things, but you've shown commitment to that for a handful of years, that looks just as great as, someone who's in 10 or 12 different organizations around their campus. Just continuing to, develop those people skills, those interpersonal skills, and those communication skills, they really go a long way. Because again, like I said, several times now, the skill sets here around healthcare are different, right? And so you may come in, I've come in, and there are a lot of things that I don't know, but having those communication skills, I've been able to find people who do, and we've been able to work together to get things done. So just continue to put yourself out there and work with others. That's really what healthcare is about, doing for others and working with others. So there's no different in administration.
Excellent. And so what advice do you have for somebody who thinks they might be interested in healthcare administration? How would you recommend that they find out more information?
Definitely look at, consider healthcare organizations you're interested in and reach out. Folks are very receptive. I know being in the position of an administrative fellow, we get a litany of students in master's programs interested in fellowships, and we talk to all of them. And that's not something that's unique to NM. Folks are generally very receptive. The healthcare admin world is very small, and it's one I'm relatively new to, but folks have been welcoming, and again, people are very receptive. So if you want to learn more, reach out. Do not hesitate to reach out. And if there's an organization you're really interested in, look at their values, look at their mission statement, and really see if the values and principles of the organization align with yours. But the information is definitely out there. Browse websites, do your homework, and again, most importantly, reach out, because building those connections goes a long way into getting those positions that you're interested in, such as a fellowship.
Yeah, networking is key. So let's talk about networking. So here in your administrative fellowship role, in your previous role as a graduate administrative intern, talk about maybe the importance of networking and some of the ways that you went about building your network.
Networking is probably the most beneficial thing for anyone in any career field. For me, the way I went about it, some of it just kind of happened on its own. I had a great mentor during my internship. His name is Jeff Albers. He was well connected throughout the system, and we would just have conversations. I'd let him know what I was interested in, and he was very helpful in terms of pointing me in the right direction. So people are happy to share names, but again, it's really on you to, to follow up and take action on the names. That's really how I got to where I am, telling people my story, telling them what I'm interested in. And fortunate enough for me, I ran into people who were, willing to hear me out and help me get to where I wanted to go. But again, there is, you do have to help yourself a bit. And so that's probably the best advice I could give. And then it also helped that I was working on a number of projects during my internship too. So most interns at NM work on one project over the course of 10 to 12 weeks, and then they present on it. I was working on 6 projects, and so I got to meet a lot of different people. And once people got wind that I was working on 6 different things, people just wanted to, meet me and see, hey, what all are you working on? Because that's a ton of projects. So, again, just, be open, be yourself. And that really goes a long way because it's a people-driven industry, and, just your ability to connect and communicate with others can take you just as far, if not further, than your ability to solve a problem or complete a task.
Awesome. Those were all the questions that I had planned, but wanted to hand it over to you, Chris. Is there anything that you would like to add about a career in healthcare administrative and being an administrative fellow to the group?
Yeah, the one thing I want to emphasize is that no 2 days look the same. So if you're interested in a career where, you always have an opportunity to do something different, you have an opportunity to grow, not just as a professional, but as a person, healthcare is definitely the industry for you. And again, this is coming from someone who, I always went to school for healthcare, but I never thought I'd actually work in it. Again, athletics and being in basketball, whether it be a coach, trainer, player, that was the only thing I saw for myself. I saw no other alternative. And it wasn't until I ran into a mentor my junior year of college who, after 2 years, finally convinced me to step outside my comfort zone, at least try it, try and get a job in what I go to school for. And I haven't looked back since. So, really just be open. I strongly encourage everyone to just step outside their comfort zones. It really takes you a long way. And, healthcare is a great industry. People always need healthcare. It'll always continue to grow. And, even when you think there's not a spot for you, I guarantee you there is, whether it be finance, marketing, media, hospital operations, community affairs. If you just like looking at data and playing with numbers, there's a spot for you. So again, there's ample opportunity. And if you're one of those folks who, just kind of on the fence about what you want to do, healthcare definitely has several, extraordinary opportunities for you.
Yeah, I agree. I have met so many healthcare administrative leaders that started off that as an undergrad in that pre-med path. And then for whatever reason, they took a course and realized, this is not for me, but make that pivot into healthcare administration and have these wonderful careers just as they would if they would be a physician or whatever they would pursue. So now it's your kind of our turn to do a shameless plug of Northwestern. So Chris, you've been here, you did the internship, and you are, gosh, is it 6 months in, 4 or 5 months into your administrative? 4? Okay.
4.
Yep, 4 months. So in your opinion and your experience, what have you enjoyed in your role here at NM, and why would you encourage people to consider us for employment?
I've enjoyed, I love the work I'm doing, so I'm someone that always loves a challenge, loves to solve problems. So there's no shortage of that in terms of work experience, but I really love the people. And again, the reason why I try and advertise Northwestern and promote Northwestern is because, again, I wholeheartedly, embraced the fact that I was someone who never wanted to wear a suit to work and never wanted to work in an office. And those are 2 things I do, every day. And I love it. And, there are not too many things I'm certain about, but that is one of them that I love working at Northwestern. I really, I don't want to sound cliche or sound like a broken record, but the people make the experience great. When I first started as an intern, I met a ton of great leaders, all with various backgrounds and people who were, as interested as I was as learning about the profession and, their backgrounds. They were equally interested in learning about me. And it's just one big team, one big family, and we're always looking to expand and grow that network. So I would encourage everyone to look for a job at Northwestern.
Awesome. So I know we have a small group right now. I encourage if anyone has any questions, feel free. You can put it in the chat, or you can also just take yourself off mute and ask any questions to Chris. Try to see if I can figure out how to get to the other app when I'm on the Zoom. So hold on one second. I'm going to ask Lindsay. I know for some reason I can't see the chat in the Whova app. Is there any questions?
There is not right now. Nope.
Okay.
Got one.
All right, I'll read it. And then Chris, if you could answer it. So do you recommend getting a job as a medical receptionist over the summer or any other type of entry-level jobs in hospital during your undergrad?
Absolutely. Absolutely. Is it make or break? Certainly not. Again, I'm someone who got an internship at NM with zero healthcare experience, but we definitely, as a fellow, we look at applicants for the fellowship. We definitely value folks with that hospital experience, no matter what area it's in. Just for the simple fact that you'll have a baseline understanding of how a health system operates, what the workflow is like, and you'll also get that experience, working with a group of others, which is something that we value to the highest degree here at Northwestern. So absolutely, if a medical receptionist is something you're interested in or something you simply want to pursue, highly recommend it. But again, it's not make or break. If you decide not to do it, it definitely won't hamper or hinder your chances of working in a hospital or health system one day.
Yeah, and to add on that too is I'd also recommend looking at our summer internship opportunities for undergrads. So those positions are going to be posted on December 16th through January 20th on jobs.nm.org. And what I would recommend looking, I don't know your background, but we have patient access internships. They're paid opportunities. They're usually 10 to 12 weeks. We also have a general administrative internship program. So you could be placed in project management, you could be placed in HR, you could be placed in process improvement, quality. If you have an interest in social determinants of health, we are going to be hiring 7 undergraduate interns that are really going to be focused on social determinants of health. We have them in community affairs. So as Lindsay put in the chat, those will all be live December 16th. And the start dates for the internship there's a couple different start dates. They're either mid-May or mid-June, depending on your availability in the program. And they're minimum 8 to 12 weeks, depending on the program, all paid. So you are paid for the internship. So that's something to consider as well. Any other questions? All right. Give it 30 seconds or so. All right, before we go into this, I just want to say thank you so much for joining us. If it was either live or if you're viewing this recording, we appreciate your time that you've taken out your day to learn about healthcare careers. And thank you to Christopher for joining us and giving a great overview of healthcare administration and the administrative fellowship program. So for now, what you'll want to do is go back to the agenda and join the overview of opportunities session. And there you're going to hear about the 10+ internship, mentorship, and volunteer programs were promoted. Then you'll go and learn more about the programs of your choice in the exhibitor hall. Remember to fill out the event survey for a chance to win a $100 Amazon gift card, which I think is amazing. And then tomorrow you'll be able to log back into the event app and view all of the job spotlights you missed, including physician assistant, pediatrician, radiology. So they will all be in there for you to come back and view tomorrow. Again, just want to say thank you and have a great evening.
Thanks, everyone.
Thanks.